syphilis. It is a sexually transmitted disease. The bacteria which cause syphilis is Treponema pallidum. Syphilis are two types: acquired and congenital. In acquired, we see primary, secondary, then we see late, then we see tertiary. Okay. So in acquired syphilis, it is acquired usually from an infected person. It can be transmitted through from drug abusers, careless handling of infected person's needle, or sexual contact with an infected person. It manifests in 4 stages. First is primary, secondary, latent, and tertiary, which is also known as late syphilis. First is primary syphilis. What happens is it develops as the site of inoculation approximately 3 weeks after the infection. The clinical symptoms appear at site of inoculation, male or female genitalia, extragenital sites like fingers, oral region, preanal region, nipples, etc. It is characterized by primary lesion is known as chancre, canker, whatever you want to say. It is a solitary, painless, indurated, non-tender lesion, non-hemorrhagic also, ulcerated or eroded. It can be ulcerated or eroded, but it is solitary. It do not cause any pain. It is indurated and non-hemorrhagic. Chancre starts as a dull red macule or papule, which later on becomes eroded or ulcerated and produce regional lymphadenopathy. It resolves in 3 to 8 weeks. Now what we see in oral cavity in primary syphilis: chancre occurs on lip, tongue, palate, gingiva, uvula, or tonsil, may be painful due to secondary infection, and are highly contagious in nature. Chancres are ulcerated and indurated lesions covered by grey greyish white membrane, often mistaken for an early carcinoma. It is usually used to see in we are usually used to see this in lateral surface of interior 2/3 of the tongue, and the dorsal surface and folate papilla is enlarged. Lymph nodes are also enlarged bilaterally, painless and rubbery in consistency, heals by scarring in 3 to 6 weeks. Then we come to, let's revise. Primary syphilis, we see chancres which appear at after 3 weeks of infection. We can see the major sites for this are male and female genitalia. Extragenital sites are finger, oral region, nipples, and preanal region. The chancre is dull red macule or papule. It is non-tender, not painless. It is indurated and it is ulcerative. It is non-hemorrhagic. Now it is very contagious in oral manifestation. When we see in our oral cavity, it is highly contagious, it is painful, it is indurated and ulcerative. It is often mistaken for carcinoma. We can see this at the lateral surface of anterior 2/3 of the tongue or the dorsal surface. Folate papilla is enlarged. There is regional and lymph nodes are enlarged, and there is regional lymphadenopathy. They are painless but rubbery in consistency and heal by scarring in 3 to 6 weeks. Now when we come to secondary syphilis, it is also known as metastatic syphilis, appears in about 6 to 8 weeks of primary infection. What happens in this is it is generalized hematogenous dissemination of the infection in the body. They are characterized by skin lesions, mucosal lesions, and generalized lymphadenopathy. Skin lesions, in skin lesions there are nodular and flat papillary or flat papillary condylomata. Condyloma lata. The skin lesions which occur are in two forms. One is nodular and the other one is flat papillary or condyloma lata. Serenate coin-like lesions on the face are characteristic feature of secondary syphilis. There is laryngitis, pharyngitis, headache, anorexia, fever, joint, muscle pain, etc. Next video.